constipation. We also do celiac disease and anything else that pops up in that situation that people are struggling with. My speciality within that sort of group is that I do disordered eating within that. So because often these conditions, food causes pain for people, people can get really nervous and anxious around food. So that's sort of my role, is to sort of cover that area as well.
Great. Okay, well, thank you for telling us a little bit about yourself. I'm excited to get into today's content. So we'll start off with an easy question. What is IBS?
So IBS is where it's classified as a disorder of the gut-brain interaction. So recently they've done some more research into what's actually going on, and we know that the brain and the gut have a really strong link, and that really plays in for IBS. So IBS is essentially a condition where there's no physical damage to the gut, and it's diagnosed by exclusion of any other gastrointestinal conditions that can cause a range of symptoms for people, including bloating, constipation, diarrhea, pain, and anything in that sort of realm of area, and it can fluctuate for people as well. So it is essentially a chronic condition for most people, that can be sort of a tricky one that we don't actually know directly what causes it, but we have a lot of ideas of what's going on for people.
Definitely. And what role does food play with IBS exactly?
Yeah, so the role that food plays is sort of, it's a really mixed bag, I guess, and everyone's a little bit different. So it is something that every different person with IBS is going to have a different experience with the way food affects symptoms and creates them for them as well. So essentially, when we go through the digestive process and we eat a meal, food gets through to the end, like the start of our large bowels, essentially where we start experiencing symptoms. And the way we ferment certain types of foods that we haven't broken down as well, which are these FODMAP foods, they then get to our large bowel, get fermented by all our bacteria in there. And then this can cause like pressure and put damage, like pressure, not damage, pressure on the large bowel, which then can cause symptoms for people. And so essentially, food affects IBS in the sense that the large bowel is quite sensitive, and food then creates pressure that people with IBS then respond to.
Yeah, definitely. And I know it can also attract water in. Is that right as well?
Yes, definitely one of those things that that fermentation process can do as well. And diarrhea can be a nasty consequence of that.
Definitely. And so in terms of IBS, how is the brain connected and what does stress have to do with it?
Yeah, so I think stress plays a massive role, and it's a conversation we're always having with patients to check in terms of what they're doing to support themselves. Are there big stresses in their life? Because definitely a stressful period can flare symptoms for anyone. I like to kind of explain it to patients in that same idea of like when you get nervous and you've got butterflies, it's
Mhm.
that same kind of connection that we definitely see, that the way the brain reacts puts our body in a state of stress. And when we are stressed, we use what's called our sympathetic nervous system. And our gut runs off our parasympathetic nervous system, which is our nervous system that sort of is heightened when we're at rest and calm. So when we get stressed, we don't sort of activate our gut properly, and that can then sort of cause like decreased motility, so that things don't go through our gut as quickly, or they can go through quicker. Another example of that being like runner's diarrhea. So for someone who's a long distance runner, they often will have diarrhea right before that big run, as that sort of stressful reaction to something they're going through as well. So we definitely see stress playing to sort of flare things up for people.
Yeah, it's so interesting how everything is connected in our bodies.
Absolutely.
Yeah. Well, okay, you did speak a little bit about FODMAPs.
Yeah.
So why does a low FODMAP diet help in a case like this?
Yeah, so FODMAPs are essentially fermentable carbohydrates in our diet. And FODMAPs are something that it can be a really tricky thing to work out what's actually setting people off and what might be contributing to symptoms. And I have a lot of patients come in and they say, I feel like I eat really healthy. I don't know why things are going wrong for me. But these FODMAPs are in foods that we would consider part of like a healthy, balanced diet. So FODMAPs essentially are these carbohydrate components in our food that when we go through and digest our meal, we don't break them down or absorb them as well as other foods. And this actually happens for everyone. So most of the population will have some type of, they won't break down something quite properly. That's how guts tend to work. But it is just the reaction to those foods when they get to our large bowel, which then causes the IBS. So because our large bowel overreacts to that sort of normal digestive process in IBS, these FODMAP foods then sort of like flare those symptoms up and can cause, yeah, water coming in and out. They can cause things to slow down and change motility, but they essentially are the thing that then triggers the IBS to sort of set off all these symptoms for people. So yeah, they exist in a range of our foods that we'd be encouraging people normally to eat.
Definitely. And we see that all the time at FodShop, especially when people are starting on the diet and they're not really sure
Yeah.
what's going on. And another big question we get a lot is about gluten versus wheat. So obviously for people that are celiac, they often, well, they do have to have a lifelong gluten-free diet.
Yeah.
But that's not the case for low FODMAP. And I know that there is a little bit of a difference between gluten and wheat. Would you like to talk a little bit more about that?
Yeah, so I think this is a really tricky one that a lot of patients get really confused by. So I think the first thing that people cut out when they start having gut symptoms is often wheat because they think, oh, I can't be having gluten. That's a trigger. It's really talked about in sort of social media and the public of it being something that contributes to bloating and symptoms and heaviness and that type of thing. When essentially gluten is the protein in wheat and the FODMAP is actually the carbohydrate component of wheat. So this is where we have this sort of difference is that we can actually manipulate wheat in a way to remove the FODMAP in it, which is one of the carbohydrates in it, but actually keep the gluten in, and that would be a completely safe food for someone with IBS to be having. So you can buy low FODMAP, like wheat-based flours, which are mainly made from like the wheat starch, as opposed to being made from the other wheat carbohydrates in that food that contribute to symptoms for people. So there's like two separate parts within one sort of little food. Yeah.
Yeah, definitely. And there is always those red flags to be watching out for that might show that possibly if something is going wrong when you are eating gluten, that it could be something a bit more than IBS.
Yeah. And
A little
sometimes
bit
it's a
more
good
about red
reason.
flags now. Yeah,
Yeah. It's sometimes like using those foods that are still containing gluten but have the wheat out can be a nice way to see, okay, do we actually need to go and like further screen for celiac if we haven't sort of had a, conclusive answer there, what's going on there as well. So yeah, it's always good to double check stuff. And definitely our red flags are a really important thing to be checking off because as I said earlier on, IBS is diagnosed when everything else is excluded. And we do need to go through and exclude everything else. Our major red flags that we're always checking on and check with every new patient who comes in, we're checking for changes in weight. So if they've lost a lot of weight, so definitely weight loss is a major red flag here. If they're going to the bathroom to have a bowel motion during the night, that's a red flag. If we're having persistent diarrhea, there's a whole of other things I'm trying to find the list in my head, but definitely there's a whole lot of things we start looking at and going, hey, that's not a normal thing to be experiencing. We need to go get that checked out further. Like history of bowel diseases as well is a major one. And it's always something we're checking off family histories to make sure, there's not bowel cancer and stuff like that in the family or Crohn's disease with a sibling or anything like that as well.
there's also blood in stools. That's
Oh
another.
yeah, that definitely that one as well.
Yes. And is there any other red flags surrounding IBS in terms of mental health?
Yeah, absolutely. I think that it can be a really debilitating condition. And I think it gets dismissed a lot because people start talking about it being, oh, it's in your head. There's nothing physically wrong with you. Just get over it. Has been a big attitude towards it for a very long time. When we know it's like really affects people's quality of life. And we can see depression increase, anxiety increase, particularly with food. And the other big one that really pops up in this population group is eating disorders as well. So we know from recent research that, the percentage of people in the general population with eating disorders is about 4%. The percentage of people with eating disorders within the IBS population is about 20%. So there's this major difference in sort of making sure people have got a nice support team around them to flag and check and qualified professionals in the area to sort of make sure there's nothing else going on there as well.
Definitely. And I know that sometimes because the low FODMAP diet can be really overwhelming, especially if you're not getting support,
Absolutely.
it can mean that sometimes it's misunderstood and people cut out whole food groups, and these can lead to really big issues. So it is really important to always get support.
Yeah.
Um, yeah. Do you have anything else to add on any of that?
Yeah, I suppose it is just, yeah, the big thing I think is like if you're going through symptoms, being aware to go and get them checked, go and have a conversation with your GP, go and have a conversation with a gastroenterologist, make sure you're going to professionals who are qualified in that area and you're getting support you need. Because doing something like FODMAP on your own can be really challenging and really tricky. And that having someone to sit you down and talk you through, okay, instead of saying like, you can't eat all of these foods, going, okay, what can we eat? What's an appropriate nutritional alternative? how do we make sure that you're getting everything that you need to sort of support you? Are there other things we need to be doing to ensure you've got support in that area as well?
Yeah, definitely. Well, thank you so much for answering my questions, Ali. I might leave it over to the audience now. Do you guys have
Yeah.
any questions you'd like to ask Ali while she's here about anything? Feel free to ask in the chat or just put yourself off mute.
Can I ask in terms of with the FODMAP diet? So I've been FODMAP for quite a number of years and ended up with SIBO as well last year. But do you find that over time people end up not on a FODMAP diet anymore, or will they always be on a FODMAP diet?
So sort of, I suppose, like what we tend to do in clinic is that you'd put someone on a low FODMAP diet for 4 to 6 weeks, and then we'd go, okay, great, symptoms are where we want them to be, and we'd start testing each sort of different type of FODMAP to work out, okay, is it that lots of them are triggers, some of them are triggers, it's actually just one of them that is a trigger for that person, and then getting back in as much as we can, because variety is really important as well. So I tend to find that most people don't stay on it for a long period of time, but I've absolutely had patients that have been told to go on a low FODMAP diet, have come in to see me after years of being on it, and then getting stuff back in can be tricky because there's a lot of heightened anxiety with a lot of these foods that people have been avoiding for years as well. So it can be a really tricky process to work out what is a problem for someone, how much of it is a problem, are there other things we need to be doing to try and help get more variety back in for people as well.
Yeah, definitely. I would say as well, there's 3 phases of the low FODMAP diet. So as Ali was saying, that first phase, that 4 to 6 week phase is your elimination phase. And that's when you want to take everything out. However, by the end of it, by the 3rd phase, that's your personalization phase. So the idea of the diet is to not just make your life really difficult and cut out all of the foods that you enjoy. It's just to check what your triggers are and then personalize it from there. And the idea is that you don't want to be on it for too long, because if you are on it for many years, you are exposed to deficiencies, especially when you're cutting out lots of different types of food groups. So it is important to just keep that in mind as well. So I hope that answered your question. Does anyone else have any other questions?
It did, thank you. Can I ask another one? Sorry.
Yeah.
I think I saw in terms of the mind gut that you were talking about, is there also the psychology aspect of the gut hypnosis? Does that go into that mind gut as well?
Yeah, absolutely. So we've got trained hypnotherapists in our clinic as well who do sort of 6 sessions of hypnotherapy, which can be a massive thing. And it's often something that I'm saying to patients, hey, stress is playing a huge role for you here. We need to make sure you've got support in that area. And that often is a really great option in terms of treatment and long-term symptom management as well. But it is definitely looking at that connection between the brain and the gut and the way that sort of stress impacts on that.
Yeah, gut-directed hypnotherapy is a very big emerging thing now for IBS in the field. Does anybody else have any other questions before we wrap up? No. Okay. Well, we might leave it. Oh, hold on. Oh, great. Thanks, Matt. Glad you learned something today. Julie, did you have a question?
Yes, just, yeah.
How does that mind gut? How do you do that? Like, is that through classes? Sessions?
Yeah, so you can book in to see our gut directed hypnotherapist if that's what you're wanting to sort of do. And we do 6 sessions. You can do it in clinic or via telehealth with one of the practitioners. And they talk you through sort of a guided meditation that is targeted at the gut to sort of help calm everything down. Yeah. They know a lot more about it than I do, but I know the basics.
Okay. Thank you.
No worries.
is that all for the questions? I don't want to cut anyone off again. Okay, I reckon that's all done for now. If anyone does have any other questions, feel free to send an email through to info@fodshopper.com.au, and I can always pass your questions on to Ali as well. Okay, well, great. Thank you so much, Ali, for coming today. It was really
Thanks for having me.
Yeah, of course. And I've really enjoyed this. I have learned something as well, and I'm really hoping that everyone else has learned a lot too. So this recording will be available just in case anybody wants to rewatch it or miss the start of the presentation. And I think I'll wrap it up there. Thank you again so much for coming. Okay, bye everybody.